If you were listening to the show earlier, we were just talking to our infectious disease expert, Dr. Fred Brown of Griffin Health, about how drugs like Ozempic actually could lower mortality rate. But here's a question. Is there any sort of impact on our teeth, the health of our mouths? So joining us back on the show is Dr. Mohammadi, and I'm so excited to have you here. You know how much I love my teeth and the health and all of that. But this is a good question. Ozempic teeth. Am I making up that term, Dr. Mohammadi?
No, you're not making that term. That term exists. But these days, when I open the TV, it become part of, and it's not just the Ozempic. I'm talking predominantly about Tylenol.
Right.
And that is, it become part of more like a political conversation rather than the scientific approach.
Mm-hmm.
To be honest with you, as a healthcare provider, every medication has benefit and has a side effect.
Sure.
And the physician or healthcare provider is the one that has to decide where is the benefit overweight the risks. And so for that reason, if the patient they start taking medication without the advice of the physician, or the medication get promoted via sensationalized advertisement
So
on
social
TV,
media,
on
TV.
TV, that's not a good way of promoting a good medicine.
Mm-hmm.
Unfortunately, United States and New Zealand are the two only countries that they allow pharmaceutical company to advertise on the TV.
Really?
Yes.
I didn't know that.
Yeah, because general public, they don't understand about the mechanism that the medication work. Is a very complex. And you start to promote your product via public. I don't think that's a right way to do it.
Right.
You can promote your product by educating healthcare provider, because they have a better understanding of
the good and the bad.
Exactly.
And even just your own health, and if that makes sense for you. So it's funny you say that, Dr. Mohammadi, because I've been very open with my listeners. I have eczema. I've had it since I was a child, and once I got to that age 25 and it didn't go away, I knew I'd have it for life. Fine. So you start to see these commercials, right? In the last 10 years or so, all these commercials of, hey, there are injectables, there are things that you could do to make sure eczema is like sort of a thing of the past. So of course I'm like, this is great. Now I go to my dermatologist, who I've known for 30 years now. And he's like, yeah, but did you realize this? And I'm like, oh, never mind. Forget I even came here. And I walked out the door, and I've never done anything with it. But to your point, the amount of people, and especially how accessible drugs have become,
Correct.
They just make that decision and don't even advise. And you think to yourself, well, why wouldn't my doctor bring this up? Well, because they know what the good and the bad, and if it works for your body. So to that point, Dr. Mohammadi, again, owner of Columbia Dental, is Ozempic showing any sort of an issue, or I should say these weight loss drugs, are they showing any sort of issue when it comes to your teeth or gum health?
Absolutely.
It is?
Yes, for sure.
Really?
Okay. So one of the things that Ozempic does, it reduce the salivary secretion. So you get the dry mouth. So dry mouth, it cause, we call it xerostomia. So saliva has some type of glycoprotein that protect the gum and protect the teeth against the bacteria. So people that they are taking Ozempic, they are way more prone to develop cavities and periodontal disease. Also,
Really?
yeah, of course. And one of the side effects that Ozempic it has, it's called nausea and vomiting. And that it cause acidic environment on our oral cavity, and it cause the demineralization of the enamel and the tooth structure. And again, it's cause dental cavity or periodontal disease. And if you have a cavity, you see a very accelerated way those caries it become bigger and more problematic. And in even again, of course there is no causation effect is still established in the literature, but the literature shows that it causes dry mouth, and we know that the dry mouth can be a contributing factor for causing cavities.
So, Dr. Mohammadi, obviously the cavities sometimes they kind of stand out. People can catch that. But periodontal disease, you and I have talked about that before. But how do you know if you have that potentially? And also, is it reversible?
Yes, good question. Periodontal disease is a disease that is kind of asymptomatic disease until it get in a very rich stage.
Okay.
When the tooth is become loose.
Okay.
So periodontal disease, that means losing the attachment and losing the bone, unfortunately is irreversible. We cannot bringing back or regenerate the bone and the tissue.
Wow.
But
It's a big deal.
the whole purpose of the periodontal treatment is prevent the progression of the disease.
Sure.
And the specialists that they deal with the periodontal disease is called periodontist, which we do have one in our New Haven location and Norwalk office that can help with the treatment of the periodontal disease.
So, I mean, I think that's something that people should take note of, obviously, and we're talking to the owner of Columbia Dental, Dr. Mohammadi. So they would be able to detect if there's a link between the two. So if say that you go to your dentist, they say, oh, this seems off, you have to go see a specialist. Would your specialist be able to identify, ask the questions, are you doing this? Are you taking any medications? They find out that, oh, you've been taking this weight loss drug. There could be a connection. They would know.
Of course, yeah, that's why they are trainings is all about. To not find all the contributing factors that it may cause periodontal disease, because it's not just the treatment of the periodontal disease, is also to eliminating the contributing factor well as much as we can.
Right. And there are several Columbia Dental locations, and if people want more information, want to connect with you, Dr. Mohammadi, and your team, what is the best way to reach you?
Our website, www.columbiadental.com, and the phone number is 860-645-0111. Open 7 days a week from 7 a.m. to 9 p.m.
Yeah, so many locations for you to choose from. Again, columbiadental.com. And Dr. Mohammadi, it is always a pleasure to talk teeth with you. Thank you so much.
Thank you so much, Melissa. Thank you.
Yeah, and just to echo what Dr. Mohammadi said, it is just so important that you check with your doctor before you try really any medication. So appreciate that, Dr. Mohammadi. We'll see you soon. We're going to be right back.